Welcome back to Motors and Medicine. On today's episode, I'm going to be discussing low T or low testosterone. And obviously, this is going to pertain primarily to males, but I will briefly discuss later in the video how hormone levels change in both males and females and how they're typically addressed in today's current thought processes. So to start, what is low T? Well, many of you watch commercials, so you obviously see that low T just means low testosterone in males. And it's perpetuated primarily by your genetics. However, it can be measured by a certain value, if you will. And we're going to get into the lab values here in a minute. But more often than not, it pertains to a male's ability to recuperate after injury, regenerate after heavy strain on the muscles, bounce back after exercising vigorously, what kind of fatigue that you're being able to sustain yourself with, and how quickly you can recover from that fatigue. Energy levels, hair, skin, nails, how they appear, how they grow, libido, sexual function. So there's a lot of things that low T can affect or impact. By definition, and every lab is different. So the lab, I've been treating low T for many years now, and the lab that I use has certain reference ranges for where your testosterone and where your free testosterone should be. So keep in mind, when we're talking about low T, it's not just total testosterone. So there's a lot of people out there that will just do a measurement of total testosterone, and it's kind of an incomplete picture. Total testosterone consists primarily of your bound testosterone. And so we need to measure unbound testosterone or free-floating testosterone that's in your circulation so that we can know how much that's impacting your abilities, whether that be metabolically, energetically, sexually, all sorts of different ways. So by definition, low T is considered, at least the reference ranges with the lab that I use. From a total testosterone perspective, we're talking anywhere between 300 on the low end of normal to as high as 900 on the high end of normal. So like 3 to 900. Now, free testosterone is measured from about 7 to about 25. Now, testosterone, total testosterone, is measured in nanograms per deciliter. And free testosterone is measured in picograms per deciliter. Now, if you fall anywhere in that range between 3 and 900, you are technically considered normal, quote unquote. Now, if you fall between 7 and 25 of the free testosterone, you're also considered to be normal. And if we're going to be treating hormones or low T, a lot of people will just stick to the numbers strictly. I've been treating it for many years, and although I tend to be very conservative with any type of hormone replacement, I do consider what the patient is experiencing, what they're feeling, their age. There's a lot of factors that you have to take into account. If you're only looking at the numbers, it's possible that some men could function just fine at really low levels of testosterone and free testosterone. But the overwhelming majority of males, if their numbers are really low in both of those respects, total testosterone and free testosterone, you will feel symptoms. You will feel more fatigue, less recovery or recuperation after an exercise session or a long day's work. Your libido will definitely drop off, and your sexual function may not be at its peak. Now, keep in mind, there is something to be said about aging gracefully, male or female, and as we age, our hormone levels naturally start to deplete and fall off. In males, it's very typical to see testosterone levels to start dropping when you're about mid-30s. Typically 40s is when most males will really start to experience a difference between how they felt when they were in their 20s and now how they feel in their 40s. There's a distinct difference in your hormone levels in that second to fourth decade. And women, it's very comparable, but most women tend to have more of their hormonal losses somewhere between mid 40s to into their mid 50s, right in that range. Now, keep in mind, hormone levels, they're very subjective because some people can sustain their normal lifestyle and activity level and not have a huge impact on that lifestyle or activity level when their hormone levels do start to fall off. But the overwhelming majority of people, males especially, will start to notice things like decreased energy levels, decreased recuperation or regenerative abilities after workouts or exercises or long work days. You'll definitely start seeing a change in your skin, hair, and nails. Your nails may not grow as thick or strong as they used to. Your skin might start to dry out more frequently than it did when you were in your 20s. And of course, your hair, you'll start to have some male pattern baldness that occurs, genetic or not. It basically starts to happen in all males once your hormone levels drop off. And that's just because your androgen levels are dropping because your testosterone levels are dropping. So your hair and how thick your hair is obviously is considerably controlled by your genetics, but also your hormone levels play a pretty big role. So you'll start to notice maybe some balding in certain areas that might happen, or hair thinning at the very least. So there's a lot of different things that low T can impact. Now, how is this going to affect your day-to-day life? Well, most of my patients that I treat complain primarily of just having low energy levels, not being able to exercise as long or as vigorously as they used to, and perhaps libido has been affected to some degree. Now, keep in mind, this is only pertaining to hormones. And there's a lot of things that can affect libido, for example. And that can be anything from diabetes to poor diet to other comorbidities. So we're only talking hormones here. And if you're an otherwise healthy male and you're in your 40s, let's say, and you start to experience lower energy, maybe your libido is a little bit down, okay, this could be very helpful for you. And there's going to be some exceptions to this rule, obviously. But for the most part, if you're in your late 30s, early 40s, you will have started to experience lower energy levels, perhaps lower libido, definitely less ability to heal and regenerate and recuperate after stresses on the muscles and the body. So how do we manage low T? Well, you can approach it a number of different ways. If you want to be very conservative, you can start by making sure that you are eating regular healthy foods and diet and exercise on a regular basis. And by that, I mean just staying fit. Eating foods that are higher in protein, lower in carbs and sugars, lower in processed trans fats. Trying not to overdo it on alcohol if you drink alcohol. Obviously, things like smoking and other recreational drug use can impact hormone levels greatly. Nicotine and marijuana especially can impact hormone levels and can affect your ability to have your levels where they should be. We'll just say that. There are certain foods like, for example, yams. It's a great food. It's a really good vegetable. There's a lot of other fruits and vegetables out there that can impact your natural testosterone production. Also, there's the consideration of when you exercise, it's the type of exercise that you're doing. If you are maintaining, say, some resistance training, weight training, even if it's lightweight, it doesn't really matter. As long as you're resistance training or weight training, CrossFit training, for example, those things can help boost your testosterone as well. So Other than that, if you feel like you've tried those things and you're still having issues, okay, well, now it's probably time for you to go and see your doctor or provider, have your blood drawn, and figure out what your total testosterone is and what your free testosterone is. And if your total testosterone is either on the low end of normal, like down at 300, 320 or something like that, or even below that, where you are clinically diagnosable as low T, or if your free testosterone levels are below at 7 or 9 or something like that, or below 7, then you may want to consider getting either some supplementation or some hormone replacement. So what is the supplementation to help boost testosterone? Well, there's a lot of supplements out there, but primarily the current thought processes and the current schools of thought when it comes to replacing hormones actually has leaned towards something a little bit different. So in the past, you would try to use some type of natural testosterone booster or some type of supplement that could raise testosterone levels by raising other measurable hormones or amino acids in the body. One example is DHEA, and that's just a protein-based hormone found in the body that when you supplement that, you can actually end up increasing your natural testosterone levels. But more recently, some of the schools of thought have been leaning more towards using things like Clomid. So clomiphene or Clomid is actually a hormone that is used to stimulate women who are having problems with fertility and conceiving. But as of late, one of the things that we have found in the literature and in studies is that by introducing clomiphene into a male, you can actually do two things. Number one, preserve the natural levels of testosterone and prevent the conversion of testosterone to estrogen. So when males age, especially when you get to that point when you're in your mid-40s or so and you start to have that drop off of testosterone, well, estrogen is another hormone that we as males have in our bodies. Our primary and our dominant hormone is testosterone, but we also have estrogen. However, when our testosterone levels start to drop, estrogen can then start to kind of creep up and actually become a little bit more dominant, which is why many males over time of having depleted testosterone and elevated estrogen levels start to experience things like gynecomastia, where they grow breast tissue, or they start carrying weight more like a woman would carry weight in their hips and so forth. So these are things that can be averted if you know what your levels are and you start the supplementation process quickly. So right now, using something like Clomid or clomiphene for a male can actually work pretty well because it will, like I said, preserve natural testosterone and prevent it from being converted to estrogen, I should say, which can lead to developing these physical features that women have. So that's obviously one way to do it. And that's generally where I like to conservatively start treatment, is using like Clomid or something like that, or Clomid combined with DHEA. If that doesn't do enough benefit for my male patients, then the next thing to consider is actual testosterone replacement. And when I've done that, I like to be conservative on that as well. I like to start with something, say, like a transdermal testosterone cream. That tends to work pretty well. I tend to shy away from injections of testosterone, mainly because what that ends up causing is it will definitely increase your levels of testosterone, but it causes this large, high, fast peak, and then you end up with a drop-off or a little trough in your testosterone levels. And to maintain it, you have to inject almost on a weekly basis to prevent that from being problematic. It's a lot easier to manage testosterone levels with, say, a supplement like clomiphene with DHEA, or if you're doing, say, a topical testosterone or transdermal testosterone cream, because you know you are applying it every few days or every day, depending on the strength and the dose. But it absorbs in such a way that it's not going to cause a huge peak and then a drop off, and your testosterone levels tend to be a little bit more stable. And that's kind of what I like to do with my patients in managing testosterone levels that are dropping pretty low, or if you're just suffering from really low T. Another thing to keep in mind is when you're managing testosterone levels, if you've tried the supplements and the supplements have helped but not kind of boosted your levels where you want them to be, and where is that, right? I get that question a lot. Where do our testosterone levels need to be? Typically, I try to shoot for somewhere in that middle ground. So if your total testosterone levels are between 300 on the low end to 900, I like to shoot for like 500. So if your levels are in that 500 range, I think that's pretty good. Once you start pushing past that, it gets harder to maintain that level without doing something on a very regular basis, like a transdermal cream on a daily basis, for example, or even starting to do injections after that. It's just hard to maintain levels at that high level. But if you can keep them in that 550 range, you're going to feel really good. You're going to have good energy levels. Everything's going to function well. And it's easy to maintain that level. And you're less likely to have unwanted side effects from hormone manipulation. Now, let's get into that. What is the unwanted side effect that you get by manipulating your hormones? Well, like I said earlier, it's something to be said about aging gracefully. You just don't want to be so lethargic or so low on energy and have such low libido that you're just not having a happy life anymore. Or for that matter, just recuperating from a strenuous activity. But one of the things that my patients can start to suffer from once you start managing the hormones is, of course, when testosterone levels start to go back up beyond where they were and it back into almost like a normal range. One thing that can happen is your blood count, your red blood cell count to be specific, your hematocrit, that is the measurement of how many red blood cells your bloodstream is carrying at any given point. Your hematocrit can actually rise up a little bit high. And a normal hematocrit, you want to be somewhere in that 45 to 50 range based on the lab that I use. But some patients can get up into the mid 50s or even low 60s. And that's something to be concerned about because having a hematocrit that high puts you at higher risk for things like stroke and DVT and blood clot formation, those types of things, right? So it's a fine balance. Treating hormones is perfectly acceptable and perfectly safe, but it has to be done responsibly. And so I try to be very conservative and have to make sure that my patients aren't experiencing that type of elevation in their hematocrit. But that is one of those things that can happen. So it is something to keep in mind. If you are experiencing a lot of these symptoms that I've mentioned, low energy, low libido, maybe some dry skin, losing a little bit of hair or hair thinning, and you haven't had your hormones checked, first of all, go get your hormones checked. Figure out what your total testosterone and what your free testosterone levels are. Once you've established that, if you fall within range, then maybe you might want to just consider a natural approach. Say changing your diet, exercise, resistance training, eating certain foods that will help boost your testosterone naturally. And we've talked about that. Now, if you've already done that and you know your levels are low and you want to try supplementation, okay, I would suggest starting with something like clomiphene and DHEA or something like that, some type of testosterone booster. And that should be able to get most males back into that mid-range of where their numbers should be. And then, of course, if you're beyond that and that has not worked, then you can really start considering, okay, hormone replacement. And I always like to suggest starting with a transdermal cream first and then work your way up from that. So just a quick, a real brief, I'm going to make a brief mention about women. And the odd thing is that the new school of thought, just like for men, we've been using something like Clomid, which is something that's typically used for women to help conceive? Well, in women, the new school of thought now is actually transitioning to using very, very low doses of testosterone to do the same thing with women, because women have both testosterone and estrogen. Their dominant hormone is estrogen, and their non-dominant hormone is testosterone. But as they age and start entering that menopausal time frame, their estrogen levels will start to drop and their testosterone levels will start to creep up. And that's why women start to develop things like hoarseness in their voice, man hands, if you want to call it that, skin that just looks a little bit more tough. All those things that women experience, it's because testosterone is starting to become the primary hormone for some women. And so in women, if you introduce very low levels of testosterone, you can actually preserve natural estrogen levels and stop testosterone from becoming so dominant. So just a quick mention there. It's interesting how it's kind of like a counterintuitive thing, but that's kind of what we're seeing in the recent schools of thought in managing hormones for both males and females. But getting back to males, if you've experienced these symptoms, get yourself checked, get your labs drawn, figure out what your baselines are, and then figure out a good game plan with whoever your provider is to figure out the best way to get you back into that mid-range level of both total and free testosterone. And that should help you regain some of that stamina and endurance and just feel a little bit more energetic and hopefully help your libido as well. Hopefully this information was helpful. I know that sometimes, there's a lot of people out there that just don't know which questions to ask if they're feeling these symptoms, especially male. And I know that males don't go to see a provider as nearly as often as females or women do. So I'm just trying to offer this information to try to help the males out there and just try to understand this a little bit better. So, like always, if you found this information helpful or reasonable, please click the like button, subscribe if you haven't, and it'll just help the channel grow. On the next video, I'm going to be getting back into the Bronco. We're going to be doing some more installs on that, and hopefully we can continue on this journey. I'm going to try to keep bringing content that is pertinent to my audience, but also just pertinent in general to whoever is willing to listen. But until then, this is Motors and Medicine signing off. I appreciate all your support. Thanks. Have a good day.